The massive earthquake that hit Sichuan in 2008 caused severe damage to transport infrastructure and medical facilities, such as this hospital in Deyang. With serious damage to every wall, window, and ceiling, the building is no longer safe to enter. A nearby hospital is in almost the same condition. Patients from rural areas find it difficult to travel to cities for a medical consultation or treatment, as many major roads were also destroyed. Taking into account the demand for health services in rural areas, the Hong Kong government sponsored Sichuan University's West China Hospital to rebuild and expand its long-distance medical network platform. This telemedicine network allows remote medical consultations and diagnostic services for patients. Dr. Wu Xiaoting, professor of gastrointestinal surgery at the West China Hospital, demonstrated the network in operation. A staff member at a rural hospital briefed him on the condition of a patient in a hospital miles away. Through the video chat function, they discussed the best therapy and treatment options for the patient. The network can also access and transmit medical records in real time. With all this reference information, the doctor can suggest the most appropriate and effective treatment for the patients. Dr. Wu noted that the network had increased patient survival rate.
The network is very convenient. It is just like I'm looking at the patients in person. In one example, a medical institution connected to the network applied for a long-distance consultation and suggested the patient be transferred to us here, as they did not know the extent of the patient's internal injuries. But our diagnosis was that the patient has gone into shock with a ruptured spleen which was causing internal bleeding. This means it would not be suitable to transfer him, a trip that would take 2 hours from their hospital to ours. So I used the network link to guide the local medical staff to treat him.
The platform also allows long-distance medical training for healthcare staff working in the disaster area. They can join real-time and interactive seminars or participate in distance learning medical courses. In this lesson, the professor instructed them on different types of poisoning. By July 19th, 180 medical institutions were using the long-distance training service, and more than 70,000 medical staff had conducted exchanges and studies through the network. Exchanges between Hong Kong and Sichuan medical staff have also increased through video conferencing over the platform. The hospital authority built this system to provide ongoing medical education and training to the medical staff in Sichuan to raise their standards in serving the community. The project's total budget is 56.6 million renminbi. The Hong Kong government conducts regular inspections and performs annual checks to keep track of the project's progress.